There we go. Two very important people. On the left, I know you all know Josh. And if you've seen our post on social media this month, then you might even be familiar with the face of Kevin. Do I pronounce this right? Barczyk?
Pachucky.
Chucky. Okay, I got it. Um, Kevin is a very important guy in terms of the medical practice that he works with up in New York. He's also a very important guy to everybody here because he's one of the medical team that looks after our good friend Josh. I'm not going to give you too much from about Kevin, but I will tell you that he graduated magna cum laude from Northeastern University with a bachelor's degree in medical laboratory science. Followed up that with a master's in physician's assistant studies. He oversees a practice where they're responsible for treating approximately 200 patients with medication assisted therapy. The vast majority of those are people who are under treatment because of addiction. In preparation for this meeting, Kevin sent me a really interesting note about kind of the process they follow in the office. And I could use all that as part of the introduction, but I'd rather ask him kind of about that once we get going. I think I'm gonna start with a question, and then I have two questions for you, Kevin.
Sure.
And then we'll kind of let Josh take over and because I'm sure he's got much better insights than I do. Um, you've been in this field for a long time and you see a lot of patients, and I'm sure you deal with a lot of people that are connected to those dealing with addiction. And one of the things that Josh and I talked about very early on when we started organizing this idea is that there's still there was still when he started medication assisted therapy, there was kind of a resistance in the recovery community and in the general public about those people who are undergoing medication assisted therapy, that somehow they're not really kicking addiction. Um, do you see any of that today? And what would your response to those people be?
Sure. Hi everybody. I'm Kevin. Nice to meet you. Um, I see mostly folks who are in early to middle to sustained recovery over their, travels and over their journey through sobriety. The folks that I see are obviously receptive to medication-assisted therapy. But the stories they tell me, the meetings that they go to, there is a constant presence of doubt over what sobriety is, and there's no universal right way to look at it from my perspective. There's always pushback. There's always the folks that are going to say, "You're not sober if you're using, buprenorphine or methadone. You're only sober if you're not putting anything into your body," which I obviously don't agree with. I think sobriety is what you make of it. I think that if you're living healthy and clean in the ways that you'd like to, then that's the great journey for you, whether it's with the medication or without. Um, there's always going to be pushback on that, though. There's definitely always
Hmm.
going to be pushback on that.
So, I'm somebody that's never been in Josh's shoes, and that's one of the things in that I'm constantly learning from my experiences talking with and interviewing and doing things with Josh. So I don't know what it's like to what it's like from an experiential standpoint to go into your office and to receive treatment without giving away, obviously, any privacy issues. Can you share with me
Sure.
um, kind of what the experience is like if I'm one of your patients?
Yeah, absolutely. So why don't I why don't I go through this as if you're a new patient to me?
Okay.
I I work for a family practice. So I'm a physician assistant. I work under a doctor, but I work independently. I make autonomous decisions about my patients, about their care. Um, and I see I see a 3-day-old baby followed by an 85-year-old with diabetes, followed by someone who's on medication-assisted therapy, followed by someone for their heart attack that they just had last week. So it's a very kind of dynamic thing. But you coming into me for the first time, I have you come into my office. I've gotten some of your medical information ahead of time. You've called the office, given us all your, demographics and info there. You come in. Usually is preceded by a urine drug screen. I hate loading the first visit with a urine drug screen though, because that's not the end all be all of what we do. A lot of folks look at, these MAT evaluations like, okay, you give a urine sample and then, you talk to the doc for 2 seconds and then you're out the door and here's your medication, here's your bill, see you next month. That's not anything that we like to put up front. So most of the time there's a drug screen up front, but for a first visit, I never do it up front. I get you into a room, a medical assistant brings you back, takes your blood pressure, asks you why you're here, and then I walk into the room a couple minutes later, and the first thing I say is, "Hey, how are you? My name's Kevin," and I give you my background, and I tell you that I'm from upstate New York. I grew up in a family with a single mom because my dad passed when I was really young. I tell you about my kid, I tell you about my wife, and I kind of give you an idea of where I'm coming from. And then I ask you, why are you here today? Tell me why you're here. What brings you in? And I get the full story. I want the details. I want everything about you from, from the first visit at least about your drug history. I want to know when you started using, what got you into using. Was it a sibling? Was it a friend? Was it a traumatic experience? I want to know where that journey took you. I want to know, if you started your sobriety journey on your own. I want to know if you went to rehab. I want to know the pitfalls. I want to know the goods, the bads. I want to know as much as you're willing to tell me, because the more I know about you, the better I feel like I can help you. So we sit down, we have a long talk. And that first visit, God, I think Josh, I mean, Josh can attest to this. I think I was in the room with Josh for like an hour and a half first time that I saw him. But that varies per person. Everyone's different. Everyone has a different story to tell, and that can be very detailed, can be very gritty, or it can be just on the surface. And I have no expectations of that. If a person wants to tell me, just the bare minimum, that's great. I need to earn trust, and I understand that right off the bat. I try to earn trust in a good way, and I try to be open about that. So, you come in, we talk, I learn your history. I learn what kind of medications you've been using, whether it's, just your, Subox. And let me just say one thing. I don't work for any kind of drug company. I'm going to use the words Suboxone, Zubsolv, Sublocade, all those terms interchangeably here. I don't work for any of them. I work for my practice only. So just for kind of ease of speech, I'll say that. But yeah, whether you're just on Suboxone, whether you take a blood pressure medication, whether you're on a diabetes medication, whether you take a fluoxetine, whether you're on a psychotropic, whether you're on Adderall, whether you smoke pot all the time, or you have medical marijuana degree, certificate. I want to know about all that stuff. So after that's out of the way, we go over your full medical history. I learn about you. I learn about. Okay, I learn, I have a blood pressure medication. I use it for this. I use this. I use this. Um, Once that's there for this first visit, we kind of make a plan. I want to know your expectations for why you're here. I want to know what your plan is for your sobriety. Some people come in and say, I don't want to be here. I think I've got this under control. I'm going to be on this medication for 9 months. I want your role, Kevin, to be to help me get off this medication, and then I want to move on my way in life. And I say, great, let's do it. Let's make a plan for that. Other folks come in and they are very early in sobriety, and that thought couldn't be farther from their mind. They
Wow.
are just getting their life together. They are just getting into this world and just kind of getting their feet wet and just getting comfortable for the first time. And that process for them may never come to finality, or they may just say, I'm not even ready to have that conversation. So I just want to know what their expectations are. Okay. And after that, we talk about that plan, how to get there, if there is a plan. And then at the end of the visit, I'd have them give a urine drug screen. I asked them about any kind of recent drug use that has gone on. The drug screen in office is a tool that I use. It's a talking point. It's not, again, like I said, the end all be all. If a person's really kind of guilty over something and doesn't want to speak up, I can look at the drug screen and say, hey, there's something in here. You want to talk about that today? And yeah, they bring it up and say, I didn't want to talk about it, but this is what happened. This is what happened. Um, I always send that drug screen out to a lab that will do a more detailed screen on it. It'll give me a lot more details a couple days or a week after the visit. Um, so information is powerful, information is useful, but information isn't everything. And there are always two sides to a story that I always try to understand. So at the end of the visit, I say, nice to meet you. I want to see you back in either a week if this is really, really early sobriety because you're really kind of uncomfortable and just trying to find your way, or 2 weeks if you've been at it for a while, or a month. The most I ever go out is a month. I see a person in my office every single month for their medication assisted therapy to talk about life, to talk about how they're doing, to see what's been good, to see what's been bad, to see, what happened to their kid this month, what happened to their wife, did their uncle die? What are the things that are going to be a limit for you this month? What are the things that are going to be in your way? What is going to be in your sobriety path this next month? So we finish that. I see him in a month. In that time, I'm here. I'm still here. I get calls from people all the time. Hey, Kevin, I'm struggling. Hey, what's going on? Can I come in for a quick visit? Can we talk? And we kind of keep the ball continuously rolling as that. So
If
there's an initial visit right there.
Okay, that's really interesting. Um, with the patients that come in for medication assisted therapy, and I hate to rely on classifications, but how would you how would you how do you mark somebody as successful when it comes to the MAT treatment?
Success is very individual. I'll give you a couple examples here. I have a gentleman I just saw yesterday. I'll call him Joe. Joe is going through a very difficult time. His significant other, um, there's fidelity in his relationship. He had a suicide attempt about a month ago. Um, and previous to that, he was using fentanyl or heroin maybe once a month. When that happened, he was using like pretty much every day. Um, when I saw him after a week or two, just 2 days ago. He'd only used once since I'd last seen him. That is a success. That is a big win for him. Um, versus a person who's been in, sustained recovery for 10 years and then, had a surgery, had uncontrolled pain, and then took too many of their pain meds and overdosed. And then they got back into using again. That's a tough time, but that's something to work through. So the failure, I don't like to think about failure versus success. I don't think that's a good way of terming that overall. I think that there are wins, and I think that there's room for improvement. And I think that there's a lot of gray space in between.
It seems like a really healthy way to kind of phrase that. I could probably ask you questions for the entire hour, but I'm going to hold off because other people are going to have things to share, and
Yeah.
probably my questions will get asked and answered anyway. So I'm going to turn it back over to Josh. Um, Josh, you want to talk about your experience with the MAT and maybe ask Kevin a question that
Of course.
other people might benefit from?
So, okay. First of all, it's a heavy subject for me, right? Really heavy subject. Great question, Rob. That last question, all three questions are fantastic. Success for me was not having every waking second of my life revolve around heroin. But my definition of success kind of evolved. I didn't know, if I had saw Kevin early on, what was my expectation? I don't fucking know, man. I'm here to get people off my back. That's why I showed up for Suboxone. And through a really great doctor who we've had in the meetings, Dr. Ramaswamy. I don't know if you guys remember, my wife came in and like cried to this man. And of course he like doesn't take any of the credit, but Dr. Ramaswamy is he's a pillar in what saved my life. Because I didn't know why I was there. My definition of success, what was success? I didn't even know. I don't even know. I'm so lost in the haze of shooting dope every day. And it is an everyday job. You don't take days off when you're an addict like that. There is no such thing as a day off, because God forbid you don't have dope. That's your worst day. So success is an ever evolving thing. Let me just say broadly, there was like a real kind of call to action in my life, right? One of the big podcasts, I think it was Joe Rogan, but somebody on there had said, and forgive me, Rob, you probably heard the story before, but somebody on there had said, Suboxone, they're better off using street dope. And it upset me so deeply. And I know that this is a thought that kind of permeates through God, it almost sends like chills through my body to think that there are probably people that feel that way in this group right now. My life says otherwise. My existence says otherwise. I needed help, and I don't know that in my life I needed to align with anyone else's idea of what a fulfilling life is. But I can tell you from my own lived experience that my life is unrecognizable today than 16, 17 years ago as a guy shooting, $1,000 of dope in his arm every day. And that's 16 years ago prices. Unrecognizable. And I needed help. I think it's hard for some people to understand the weight of addiction if you haven't lived it. I'm not ashamed that I needed help, but this is a ballsy thing. It's a ballsy thing to come out and say that Suboxone saved my life. But I'm saying it to you guys, and I'm not, I felt like a real coward. I just kind of shut up and hid and said, hey, things are going all right for me. I'm just going to keep going this way. But that's not how I want to live my life. I want to be a force for good. Maybe medication-assisted therapy isn't for everybody. I can only speak of my lived experience. But you talked, Rob, of the pushback, and there's so much of it that this is a scary thing to say out loud. I've been saying out loud since we started DSC. I had a conference at your college about it, Rob. So we've been saying this out loud, but it is. I want to just acknowledge it's a frightening thing for me to say, but it is my truth. And I do think that there's people out there that can change their life with medication, with the right doctor, the right PA, with the right person overseeing, can change their life. Because I had tried to get sober so many times and failed. And I'll, in the interest of like full on honesty, I am envious. I'm envious of people that were able to go cold turkey. There are people I know that went cold turkey because they got arrested 6 times and they had no choice as they sat in jail. There's people that fucking were able to find it. I wasn't able to find it. When you feel the all-encompassing darkness of addiction, I don't think you'd come down on me for asking for some help. I really don't. If you felt the weight of this thing that you have invited in, so what? I take Suboxone. Fast forwarding, and I don't want to monopolize the time here, but there came a time, my doctor kind of at some point had said, let's give this 6 years. 6 years felt like a lifetime when he said that. That'll never happen, 6 years. And all of a sudden, like 6 years was up. And I kind of, we weaned down to 1 Suboxone, to 1 8 milligram a day. I'm sure there's people that take way less than that. But the people that love me were uncomfortable with me coming off. And to be perfectly honest, so was I. And maybe that's the last obstacle of this addiction, that I do feel like in my life I've transcended it. I do. I really do. In the important ways. I don't think about drugs in a way of, man, I want some drugs. Never. That never enters it's almost laughable. I do live in fear of that switch flicking on me. because there was a time that I didn't think of anything but drugs. And my life is fulfilling, you guys. I'm afraid to change a thing. And if anybody wants to look down on me for doing Suboxone, I got nothing but love in my heart for you. But that doesn't really affect my day to day. I'm a happy person and I really like my life. Hey, I see Ryan Benson in here. One of my close friends, Ryan, I love you, but I do want to just briefly tell the story. You shared a meme with me once and it broke my heart. But this is a line of thinking. You work in recovery. This is years ago too. It was funny as hell too. It was a picture of a Walking Dead zombie, and it said, "I'm clean, bro. I'm on Suboxone." And I wrote you, it was like, "I'm on Suboxone," and you were like, "Dude, I had no idea." And I felt like I disappointed you. And I do feel that's something that I have to. It's been years of kind of coming to terms with that. I feel I don't want to disappoint anyone. At the same time, my version of a fulfilling, happy life, I guess it can't always line up, but I'm saying it proudly. I'm proud of that my life is this version, because this was a version that felt so unreachable, so unattainable to me. I would see other people being happy watching a movie or getting a snack or sharing time with friends, and I'd say, "What? That'll never be me. That doesn't live in me," and it does now. I find happiness in feeding trees outside and mowing my lawn, all these like normal things. And sometimes I get stopped and like a tear wells up because I'm so happy just living my life, and it's not based around substance. Anyway, Kevin, I'm curious. I've been looking forward all month to this because I want to hear how do you find yourself doing this as a PA? I mean, do you guys have any idea how much the universe takes care of me? Dr. Ramaswamy was with me for 16 years, and he retired, semi-retired, and wasn't going to be able to see me anymore. And I just find myself with like the best PA in all the land, a caring, kind fellow runner. Most of the time with Kevin, it feels like a therapy appointment. Like we don't even talk really about Suboxone, but I think there's an earned trust, but there is a kind of mutual understanding coming in there that I have so much time, which I appreciate. What if I got in there with some hard ass who made me want to come in every day? Do you know how almost like defeating and demeaning that could feel to me? Do you know, Kevin, I actually found myself at a rehab. I was seeing a doctor, really nice doctor, Dr. Parent in Albany. I don't know if you know her, Colleen Parent. We got along so well, but her practice, she took a job at a rehab, and I go in there and I'm sitting next to a bloke literally sweating out heroin. He's there day 2 kicking, and I'm just like frozen from that smell. And I haven't smelled that in 15 years at the time. And I text Dr. Ramaswamy, and he said, "Stand up and walk out of there." And he had a talk with Dr. Parent, and he said it's dangerous for him to be there. Now, I didn't feel like, "Oh, I better go out and get some drugs" at all, but I didn't want to be there. I did feel like it undermined, and she agreed. And then I went back to Dr. Ramaswamy. I was only with Dr. Parent for maybe 6 months. But that was because Dr. Ramaswamy moved out. But I am curious how you found yourself as a PA in medication-assisted therapy. Tell me that first, and I'll build off that.
Sure. Well, you actually touched on a couple points I want to speak to there. The first thing you said, every visit it feels like kind of like a therapy session almost. Yeah. I think that's really important because where does addiction come from? Like very, very rarely does it just come like out of the blue. Most people who deal with dependence, it's a psychological thing, right? And like the quantity of people that have come into being addicted to drugs because it was a party drug thing and they have the means to use all the time and they have the capacity to use all the time and they don't have any mental health struggles to go with it. That is definitely in the minutia of the folks. So talking about anxiety, talking about depression, talking about the stressors in your life, that's where I feel sobriety really lies. Because we can talk about Suboxone all day. Well, I mean, what can we ask about Suboxone? Like, how are you taking your medication? Are you getting any withdrawals between your doses? Like, yeah, that's good to make sure you're comfortable, but the bigger picture is, how is that Suboxone fitting into your life, and how is your life being run beyond the medication? So, that being said, how did I get into this? I grew up in but my dad died when I was really young. I have a brother and sister. I grew up in a pretty nice area of upstate New York. My dad died when I was really young though, and he was really interested in medicine in his passing years. So that kind of trickled down to me, and I decided one day I'm going to go into medicine. And here I am out in Boston in my emergency room rotation, and there's an in-service on buprenorphine and what buprenorphine could do for people. And it would just kind of absolutely blew my mind that it's something that could take away the cravings for drugs. It could help you to not sweat your way through your days and your nights. It could help you to be a functional parent, a functional friend, keep a job, keep you from dangerous situations where you're going out looking for drugs. And it blew my mind that everyone wasn't like writing this medication left and right. So fast forward a couple months, I'm in my last rotation in PA school, and the two doctors that I work with here in upstate New York, they write for Suboxone, and I picked I wanted to work with them every single day of that rotation. I learned and learned and learned, and found out that they're really the only two in the Albany area that had like a dedicated practice for medication assisted therapy. So that definitely piqued my interest. As soon as I graduated, I put in an application. I said, I want to work for you. I really want to get into this. Um, how does addiction fit into my life specifically? Um, I've never used drugs. I smoked pot a couple times, but nothing big there. I drink occasionally. I had an alcoholic stepfather growing up who was very verbally abusive to my mother and myself, and that really put me off of that. But it gave me an inkling. The first intervention that he had, the screaming that came from the basement, the way it upset my mother and what it did to my family, it just kind of lasted with me. And there I am years later in the emergency room of Boston Medical Center learning about Suboxone, and I just get these images flashing back to me of these altercations that always happened between my stepfather and my mother. And I realized that this is something I really, really want to be involved with. And then, 10 years later, I was probably the first person, the first PA in New York State to try to get a license to write Suboxone, because for a long time it was just MDs and DOs that could write for Suboxone, and that's where a lot of the holdup was. Like this medication, I don't want to say it should be put in the water. That's horrible, but it should be
No,
talked about more. It should be used more. This is something that should definitely be out there, and the word on this should be that this is something that could help a specific type of person. It's not for everybody, but it should help a specific type of person that could use it and wants to use it. Because
absolutely.
there were not the providers available to do that. I feel like that for years, in Albany, sure, but the rest of the world was just disserviced by that. So I really made it kind of my mission to try to get more people, to try to get other people to take their, licensure exam so that they could write for buprenorphine and to kind of pass that along. Yeah.
Well, Kevin, so that just to make sure everybody understands, I probably didn't do the greatest job of explaining that. What I meant was how lucky I am with the universe landing. It's not easy to find a doctor or a PA that can
Yeah.
understand, that takes the time to understand. And I do. I know I told you I got like teary eyed in Kevin's office the other day because it really. I just feel so lucky and blessed that I didn't scour through the yellow page. God, I sound old. I'm really dating myself by saying yellow pages, but I didn't scour through Google, going through doctors. A friend recommended you, and it's perfect because it is kind of a unique thing. I think to have somebody come in with like 16 years on this, and Kevin had mentioned before that he doesn't work for the drug companies. I want to say that too. Like, I never thought I'm not like on the team big pharma here. Again, it's just my life experience that's really I think it's important to be genuine and authentic about your own life experience. It just happens to be a kind of hot button issue. And but yeah, it's not easy. It's easier than ever, and I'm really thankful for that. For people, I mean, I still have friends in the streets, and I try to send them to people like you. I didn't grow up here, so for a lot of my friends that are trying to put it eloquently and say in the streets, you know, it's almost impossible for them to get an hour north to get up here to Albany. But I'm always trying to push them towards talking to somebody. And it's been challenging keeping those relationships around. And oftentimes I fail, and I'm sure you can imagine why. But it kind of, next question, and then I'll get on to all the hands we have raised. How do you deal with, okay, I just want to word this correctly. How do you deal with like drug seeking behavior? Someone who comes, okay, maybe this will make it really clear. I have a friend who he's so anti Suboxone because he went and got prescribed Suboxone without an opiate addiction. He wasn't addicted to opiates. He tried heroin one time and then was bragging, I got a Suboxone script, and he was getting high off of it. And I remember he loved it as a recreational drug. How do you combat that? Like people trying to game, does that ever even happen to you? Is that something that happens?
So that's tough. I don't have a lot of people that come to me with like no background or no backstory, and it's very difficult to pull through what's true and what's not. A person can spin any kind of story and act compassionate about it, and you know, you'll get it. But they're fail-safes, and we look for diversion. We look for what people are doing with their medication. For some reason, something doesn't add up. It's gonna not add up over time. And from visit to visit, from month to month, something's gonna slip. Something's gonna fall. Um, I've got uh, the drug screens, like I mentioned. They're not the gold standard here, but they're a lot of information. They tell me if a
Absolutely.
person is using their Suboxone. They tell me if the person is dipping Suboxone in the urine cup and then sending it out. Because that won't have any metabolites. That won't have any breakdown products from what your body does to the Suboxone in the urine sample. Um, I've had people give me horse urine, dog urine. I've had
I'm
friends,
sure.
I've had people, oh, no, I see the laughter. Oh, I'm not even kidding. I've had people have their significant other who was on Suboxone give me a sample. And they admitted to it after I kind of caught them afterwards. There are the information I get from these drug screens tells me what's in there, but it also kind of tells me quantities of what's in there. So if a person is written for, 24 or 32 milligrams of buprenorphine a day, but the amount of Suboxone that's in there and the amount of the metabolite is minuscule, then I have questions. Like
Mm.
what's going on? Well, like I would expect that with maybe using 2 milligrams again. Where's the other 22 milligrams? I bring people in for repeat drug screens between their visits if I'm suspicious about something. I have them bring their films in with them so that I can count them to make sure that they're not, here's your 84 films for the month. I'll see you in a month. And then they leave the door and they sell them to somebody down the road. Um, we do this pretty frequently if we need to. There are folks that you understand, and there's people that you get a rapport with over time. And I feel like I'm a pretty good judge of people after the years of practice. I'm not saying that people aren't pulling one over my head. I'm sure that some people are, because people are practiced and people can be very manipulative. But in the interest of believing that most people are hopeful and want to find a better life for themselves, I try to do what's right, and I try to see the good. And when the good just isn't there, or there are too many things lining up, that's when all the questions come in, and that's when I try to go back on it.
Yeah, fair enough. But this story was also a lifetime ago. I think Suboxone felt very new.
Mhm.
And this guy I'm talking about, not a bad guy. He probably got caught in a few months. It always just irks me that he's such a loud anti-Suboxone guy when I just feel like he doesn't have the full story. And he's a friend
Yeah.
of mine. So it can
Mhm.
sting, you know?
Yeah.
Especially since he like gamed the system and used it to like get high and
Yeah.
sold them, and now you're Mr. Anti-Suboxone. Okay, let me shut up. I see a lot of hands raised, which makes me so happy, you guys.
Yeah, we've
Um,
actually got some new voices as well, which I love.
Terrific, really
Um,
terrific.
I'm going to go with one that looks like it's out of order, but it's not, because their hand was up early, and I guess they hit the button and put it back down. But I would like to start by going with Ray of Sunshine.
Hi, everybody.
Hi.
Can you hear me? I just want to make sure everybody can hear me.
You can. You're perfect.
Yeah.
Okay, so I have kind of a different kind of perspective on this because my journey started whenever I had surgery in 2016, and I ended up as a chronic pain patient. And I never had the desire really to be on medication, but nothing was helping my pain. And as I was healing, my pain got worse and worse and worse. So I ended up at a pain management facility, which was not the best place. The first one that I went to was probably the most judgmental, awful place that I've ever been in my life. And they did nothing but kind of make me feel like dirt, for the lack of a better way to phrase it. But now, after, I'll just be straight. So, whenever I moved to the place that I'm at now, because I metabolize medication so quickly, I was on a really high dose of oxycodone. And I never, like, everybody in my family knows this, I didn't even want to take it. And it still didn't help my pain. So I got introduced to Belbuca and including that with my oxycodone, but those were kind of fighting in my brain because obviously one is knocking the opiate off of the receptor and the other one's trying to lock onto the receptor. So there was kind of this breaking point in that journey of mine. And I was actually interested because I did a lot of research on different medications that help pain patients and keep them away from the like super serious kind of respiratory issue, digestive issue kind of medications. And I discussed with my doctor, since I already had, well, my nurse practitioner, that since I already had the Belbuca, aka Subutex, in my system, that I kind of wanted to try just going straight on to the Subutex. And she was like, that's completely fine with me. Let's try it out. It will probably be hard transferring completely to that at the dose that I was with the oxycodone. But now I take 3 8 milligram tablets of Subutex a day. And back in, let's say, around 2020 or so, or maybe even a little later on than that, maybe 2022, I would say, was whenever I was just bedridden because of my pain, and my anxiety and depression got the better of me and nothing would help me. And it felt like I was in a dark hole with no light at the end of the tunnel. And once I started the Subutex, it was like, the weird thing was, and my mother and my doctor, everybody that knows me can attest to this, it was so crazy because for years I was taking these narcotics and they were blocking the wrong pain. And I didn't even remember what it felt like to feel this on my hand or to be flicked, because it was just kind of covering the outside pain, if that makes sense, and not the interior pain that I was dealing with, which is my hip and my low back. And once I took the Subutex, it was like I could feel again, like I could feel in my fingers. It was so cool. And now that I take the Subutex, my pain is under control and I love the fact that there are people on this chat that are pro Subutex and Suboxone, because it is such a helpful medication no matter which way you dice it, whether it's pain or if it's for Matt. I mean, both ways, it really does help, and it has saved many lives. And I know that firsthand because my ex, who I'm still really close to, he struggles with heroin and fentanyl, just numerous different things that he can get his hands on. But whenever he just got out of kind of a rehab situation, and he is now back on his medication and is doing a lot better, has put his weight back on and is able to work full time. So seeing that difference, and with both of kind of the way that we are, it's really cool to see that the medication divided between the two scenarios has really ultimately saved both of our lives.
That's
But
really interesting, and that's wonderful. If I can take it for a second here, I want to explain kind of what
yeah,
you're experiencing to the other folks that might not know. Buprenorphine it's an opiate. So there's no delusions about that. You know, taking Suboxone, you're still putting an opiate into your body every single day. The difference is that it is an incredibly long-acting opiate, and it only partially attaches to all of those same receptors that oxycodone, fentanyl, heroin do. So the long-acting measure of it and the partial binding to it is the thing that takes away the high. It takes away the euphoria, and it just, for some people, brings the pain down, and for some people, just massages those receptors that would always be recepted when they were using drugs before, you know?
that was another thing that I was going to address. I still, to this day, I have never been able to understand what it means to feel euphoria from those medications.
Hmm.
Like, no matter what, even before I went in for my surgery and they gave me fentanyl because I'm allergic to a lot of medications. It's crazy, but I didn't feel any kind of happiness, or a lot of people describe it as like a warm, fuzzy hug. And I never felt that. It always just made me feel almost like not tired, not groggy. I was just normal. And whenever I've always tried to understand it, because my background is in kind of like therapy, counseling, and whenever I hear that, it's so hard for me to grasp because I was on those medications for so long. And even remembering back to the very first time that I took, I believe it was hydrocodone after I had a wisdom tooth removed. I never had any kind of high, as it's often called. And I just find that really interesting. It's never affected me that way.
You're not alone, though. I just want to say briefly, my wife also, she had some mouth procedure and she took a Vicodin, and I made some comment like, it's being silly. This is also 12 years ago. I said, "Oh, you lucky dog." And she took it and she said, "I will never take that again." She hated it.
Yeah.
It didn't make her feel good. Well, everybody's different, right? I mean, gosh, I'd say that's a good thing, ray of sunshine. I'm glad you didn't take it and say, "Oh, wow, I love this," because that's what I did. When I tried drugs,
Right.
it's very cryptic. I said, "I've waited my whole life to feel like this." That's what I
Right.
said the first time I tried it. But not even friends of mine that we would party with tried it and said, I just feel blah, not into it. So everybody's different. So your experience isn't totally unique, but it is interesting, man. That is wild. I chalk it up to just everybody's different. Maybe Kevin could probably shed a little bit more
Yeah,
professional light on it.
yeah, I was gonna ask about that.
So everyone's got different pain receptors. They're the mu receptors in the brain where the opiates usually bind to, and some people's are chock full, and some people have very few of them, so they experience pain in different ways. Some people experience less arthritic or sharp pain and more neurological pain. And that's where the breadth of different medications come in to help. I mentioned earlier that, the majority of people that I see and treat are on medication assisted therapy for dependency, but I do have a fair amount of people that use it for pain too. The long acting aspect to its response is very desirable because people don't want to have to take oxycodone in the morning, then in the afternoon, then in the
Yeah,
evening, and then at
roller
nighttime.
coaster.
And it makes them feel like an addict, and they have to go to the pharmacy and pick up 200 pills every single month, and it makes them feel like an addict, and makes the pharmacist look at them like they're an addict, and they despise that. So using something that's long acting that keeps their pain under better control, that there's much two things, less risk of abuse of, and less risk of diversion of, is again very desirable, I
Wow,
think.
I never actually thought about that, Kevin, how it makes somebody feel to go into the
Oh man,
pharmacy and pick that up.
Sure.
Oh,
it is
though
brutal.
I take. Oh, I'm sorry.
No, it's brutal. Almost universally, every person that I see,
Wow.
they that was on pain pills, and sometimes even with their Suboxone too. A lot of folks on their Suboxone too. They walk into the pharmacy, they're here for my Suboxone, and they get the new pharmacist or the person that just gives them the side eye, and my patients try to be the bigger persons and people, and they just kind of shrug it off and say, this person doesn't know what they're talking about. That's fine. I'll brush it off. But this is what folks trying to get sober deal with all of the time. And it's the last thing that they should have to be dealing with while
Right.
getting sober, being looked down upon for their sobriety journey in the first place. How horrendous is that? You
Yeah.
know?
I
Hey,
mean,
Ray of
the
Sunshine,
last thing.
go ahead.
Oh, I'm
We got
sorry.
to move on here in a second.
The last thing that I'll say is what's really interesting is whenever I switched from the oxycodone to the Subutex, that was whenever I really got the, shall I say, dirty end of the stick from the pharmacists. It was like almost a complete 180. It was like they were okay with filling a 100, and I believe at one point it was like 120 10 milligram oxycodone a month, and then just doing my 90 Subutex a day or a month. They're like, what's wrong with you?
Mhm.
Like, that's the look that I get. And I just find it so strange that you go from one medication that is so desirable to other people to one that's a little less desirable. And they look at me like I'm cuckoo bananas and have 8 heads.
Mhm.
I've experienced that as well. Trust me, there are moments in life where it can be, you catch a side eye or a vibe, but I don't know. It's also been a teachable moment for me because I try to just lead with kindness, and I've got a pretty good string of making friends with my pharmacists at this point. And I got to say, it's been a long time, but I have experienced that, and it can be embarrassing. Still, I'd like to say I transcended that, but I haven't. If I have to go to a hospital in a strange city and say something happened on tour, there's always a little bit of embarrassment. Most of that is probably my own shit, but I've definitely got the strange looks from a pharmacist like
Yeah.
in town locally. But okay, Rob, I know we got to move on. I'll
Yeah, I
talk to
know.
Ray of Sunshine all day.
I hate always having to be the bad guy to push the
I know,
meeting
Rob, you
forward.
poor thing.
But I know at some point I'm going to see Tammy again. I'm going to go to give her a big hug, and she's going to she's going to punch me in the nose.
Yeah, well, that's all good.
So we've got 6 more hands up, and I want to hear from them all. So let's see if we can fit everybody in, and we will hear from Janine.
Janine.
Hello.
Hi,
How are we
Janine.
doing tonight? Hello, hello. Few things. Raz, I'm gonna try not to get emotional. It
Oh
is
boy.
so good to see you today. I know they've got some amazing things that they're gonna say, but I am so glad to see you. I know I cry every meeting. This is not, yeah, we're fine. We're fine.
We're
Um,
fine.
but I'm so glad that you're here and that you've joined us. And after everything you've been through, it's just so wonderful to see your bright, shining face. You're an angel to the community, and it's great to see you here.
Here, here.
Um, yeah. Second quick note, Ray, I also don't respond to pain meds well. I've had a litany of surgeries because I have very unique ways of hurting myself. And I've been, yeah, they never ever work. And then nurses give me dirty looks. But after all of that, I don't know if this is a question or a ramble. So just like ride the roller coaster with me. There's been a lot of discussion so far about like stigma, um, sort of the shame behind Suboxone and like MATs. Um, and I think I'm just for myself having a hard time wrapping my brain around like the logic behind that because like we all anyone who's affected by addiction and anyone who's trying to recovering knows going into it that addiction is a disease. And so, why would you not want to treat that disease? And would Suboxone not be a treatment? Like, it's almost like it's getting that like parallel stigma with, you have, I don't know what they're called in the States. I'm Canadian if you're new here. But like, you've got Adderall, Concerta, Vyvanse, all of those ADHD drugs that have like a paradox effect where they're a stimulant for people who aren't ADHD, but it's a paradox effect. So if you have ADHD, the opposite of intended is going to happen. So instead of stimulus, there's calm. Um, and so those who are ADHD understand its benefit, and it almost makes the community like that much closer. And I feel like with stigma, a lot of the times it's people breaking down their own concepts of perfectionism within themselves. Perfectionism, if like you're in the mental health industry or any of that world, perfectionism is a huge beast to try and tackle with anybody who's struggling um, with any sort of mental health. And so um, I guess maybe my question is if someone decides to take MATs, is there a referral for a therapist so that way they can help with their own, like with those coping skills to be able to combat perfectionism, to be able to gain the confidence they lacked when they were in their addiction, which is why they needed the escape? Like, is there any therapy that can be offered in tandem?
Absolutely, 100%. And as I said, like with addiction comes anxiety, depression at its core. And unless you treat the base of it, then how do you expect to, treat the after effects of it? Most folks that I treat are actively engaged in cognitive behavioral therapy. They speak to a therapist once every month or a couple of times a month. Some of them have psychiatrists. I treat a lot of them psychiatrically with their antidepressants or anxiolytics. I treat some of their ADD. I treat some of their psychiatric issues at the same time. But I mean, the takeaway from all of this is that you need support to be healthy. And if you're not getting that support, then don't ever expect to be able to turn the bend on your own.
Mm.
Well, that was too much of a finality there, but without the support, how are you going to make it to the end of the line? It's always a team that can help to get you there quicker and easier and more effectively. We want people to have a big support group all the way, and I'm not the only person that can help you. You need to help yourself, and you need to have other people help you along the way. So yeah, psychiatrists, psychologists, licensed social workers, mental health advocates, all of them are a huge integral part of the team. 100%.
I love that
And
answer.
there was a point where we kind of mandated everybody who was in our program to say, hey, you got to be seeing a therapist, you got to be seeing a therapist. But then we saw kind of a lot of kickback from that, and realized that it was actually You know, in obviously some situations when you're provoking that, when you're getting into, you know, memory dredging up memories that are not going to take you to a good place, that can actually put a dent in your sobriety, and that can push you further down the line, if you're not ready for it. So we strongly encourage everybody along the way to be engaged with the mental health advocate along the way.
That's wonderful to hear. That's incredibly insightful too. We're launching some collaborative efforts with the organization called Heart Support, and they're very focused on mental health, and there's such a link that obviously you see that in your practice. So the next hand we have up, thank you by the way. And so the next hand we have up is Kayla.
Kayla. What's up, girl?
I'll ask you to mute. Let's see if that helps. There we go.
There we go.
Hi, how you doing?
So,
I just wanted to kind of share my experience with how I kind of found I self-medicated for pain management for years the wrong way. And I kind of fell into something that actually helped me through a doctor, like legitimately, after having a pinched nerve. I was prescribed gabapentin, and for the first time, I finally found something that like didn't cloud my brain, but also helped dull the pain enough. The way I describe it is like imagine a person just like screaming in your face. You can't ignore that. But taking this medication has helped me. So it's like it's kind of like 6 feet behind me. I can still hear him screaming, but he's not so much in my face that it drags me down. It's all I can think about. I can't function. So that's a medication that's helped me. And I just kind of fell into it because with the pinched nerve, obviously that's like the gabapentin is for nerve pain. They gave it to me and it did help that. And I just noticed that it's just dulled the rest of the pains that I have had my whole life, that I have self-medicated with drugs this whole time. And so it was kind of a happy accident. It also got me to learn to deal with my pain in other healthier ways. I go to get a massage every month. And I remember like the first time going, feeling so validated with her being like, feeling my knots and be like, wow, this must be really painful. I'm like, yeah, it is. And for years, like, people telling you that the pain is kind of in your head, you start to believe it a little bit. And sometimes maybe a little bit it is because when you're depressed, like it's
Everything's amplified.
yes. And you focus on it, you dwell on it instead of just kind of dealing with it. So yeah, I just want to share that little part of my story, how medication has helped me recover and how I just kind of happily fell into it. And I feel very lucky for it.
That's wonderful. Thanks for sharing. Um,
yeah.
Gabapentin is a very interesting medication. It's used for a lot of different things. Some people, it's known for its nerve pain relief, but a lot of times I use it in other ways. It can be used as an anxiety reducer. It's an
It
anti-seizure
has helped a
medication.
lot.
It's an anti-seizure medication. It helps with acute withdrawal. So when folks are weaning their Suboxone, that's one of the tools I break out of the toolbox to, you're cutting down from 16 to 8. Let's give you 100 milligrams of gabapentin that you can take 3 times a day with your dose that you previously were using, and hydroxyzine or clonidine or something like that to go with it. It's a very utilized drug, and it can be very helpful. However, at the same time, every medication has its double-edged sword. In a lot of states, gabapentin is a controlled medication at the same time, as in a controlled medication like a stimulant or a pain medication or a benzodiazepine or something like that. So using it carefully, using any medication carefully is the name of the game here. But for you in your scenario, that's fantastic. I'm so happy that it found its way into your world and you were able to find some level of peace from it. It's great.
Yeah, and I have seen like the stigma with gabapentin too. I watched like videos about how like awful or bad it is, and it's just I feel like it's helped me so much, and I'm grateful for it, you know.
I'm grateful too for it, Kayla. That's I am curious though, Kevin, What about as gabapentin is kind of multi-tiered and nerve pain, but also an anxiety reducer. I've read things about Suboxone having in kind of antidepressant use in it. Is there any truth to that? I've also read that it helps alcohol cravings, which would line up in my life. Like I do not ever crave alcohol. I can have a beer, but then that's it. I don't think I've been drunk in years. Is that
The
true?
gabapentin did that with me too. Honestly, I used to drink like almost every night, like not get drunk, but I'd have a couple of drinks to take the edge off at the end of the night. I've been drinking like 2 years now.
It's terrific though.
Yeah.
What a beautiful thing. And yeah, isn't it funny that well, Kev, what about that? Is there any truth to the antidepressant?
So that's actually it's a difficult question to answer because there's a lot of different kind of scientific reasons for it.
Okay.
The mu receptor where it binds, when that's overstimulated, it can amplify depression, can amplify anxiety. So when that stops being filled by, oxycodone, fentanyl, other things, and is just partially agonized by the buprenorphine instead, it does give some type of mild depression relief in some people.
Okay.
Not everyone. Number two, the receptors, the mu receptors and some of your dopamine receptors and serotonin receptors, they're all in pretty close proximity. So there's a little bit of spillover. So what massages one neurotransmitter receptor might massage the other ones at the same time. Um,
Interesting.
and the final part of your question was, can Suboxone be used for drug or for alcohol dependence? Well, can it be effective for alcohol dependence? It's actually FDA approved for alcohol
No
dependence
shit.
too, but it's not frequently used for that alone, because it's an opiate. There's a medication called naltrexone. It comes in an injectable form called Vivitrol. And
Yes.
that is what they consider, and that's what I consider too, a safer alternative for alcohol dependent syndromes alone. I give out a lot on naltrexone for folks who have alcohol use disorders and want to work on their alcohol use.
Wow, interesting, man. I don't know why I never asked you about that in our actual meetings because I've always been fascinated by that. But all right, Rob, I'm shutting up.
Okay, no, you're good. I got four more hands up. One of them's new. I definitely want to get to everybody. So the next one is a face and a voice that I'm very happy to see with us, for many, many reasons. And it is Raz.
Raz. Yes.
Hello, friends.
Hi.
It's so nice to be here.
Oh, we're so happy you are here.
Me too. It has been a very long, exactly 2 weeks since surgery. But I'm here and I made it. And brain surgery has been a process to heal from, let me tell you. Your
Oh my
brain does
God, I
some
bet.
very strange things when it thinks it's in trouble. I mostly just want to comment on the fact that I think this was a really good subject for this month. I am someone who has a lot of health problems myself and benefits greatly from medication management in a variety of settings and applications. So it's always good to see positive influence in the steps of medication helping with any sort of health problem that you're experiencing, whether that be an addiction or an alcoholism or a nerve pain or whatever your current issue is. Not being stigmatized into thinking that you don't deserve help is a huge, huge thing. And so seeing a really positive outturn for this subject was really close to my heart. Medication assistance got my brother through his rehab process when he was cleaning up from alcohol. If it had not been for that and his psychiatric team, he would not have made it through that process. So I am always happy to see positive notes in the right direction for people who are in any recovery effort or trying to come to terms with things going on in their body. I am also a chronic health person with lots of pain issues. So this has been a really beneficial meeting for me to learn a little bit more. I live in a part of the states where you can't really get pain management easily. And so I'm on like 27 different medications trying to treat several different disorders, all trying to do it without pain meds. And it is a process.
Mm.
That said, it is good to learn about what options exist out there, especially as a harm reductionist, because working in harm reduction, it's important to me to have as much information as I can to help point people in the right directions towards whatever their goals might be. So this was a really good meeting. I'm probably not going to stay much longer because my brain is still applesauce. But I wanted to comment and say that everything that people have had to say has been valuable. This is a case that I've seen proven to work. It saved my brother's life. And that says something. That kid rolled a car 6 times across the freeway and lived. So, like, seeing positive direction in something that I think is a huge gift in the medical community is really nice. That's all I got to say. I'm happy to see you guys.
We're happy to see you, Raz.
We are definitely happy to see you. Thank you
It's
for
always,
sharing this.
can you what?
I said just
Oh,
thank you for sharing.
Oh, yeah.
I did want to just briefly say, Raz, you said, and I wrote it down, you said about folks or people not being stigmatized into believing you don't deserve help. And
Correct.
that's the whole reason. That's it in a nutshell of me coming out and saying, this shit was scary, man. It still is scary to come out and say, I'm on Suboxone. And I stood at Collin College at a fucking podium with Rob. I couldn't have done it without Rob being there. And we ran into that stigma. And I want to like face it head on. And I don't think that I know everything. I just think with something that's robbing us of so many people and bringing in so much darkness, I just don't think we should be cutting down folks or ostracizing people for trying to get better from something that's wrecked their lives, right? We can all agree this shit wrecks lives.
Yep.
Why are we making a whole sect of people feel badly about trying to, oh, no, you're not getting help the right way? And I say, well, my lived example, my experience in life says otherwise. I think people that really kind of prop up that stigma of this being bad and unworthy of trying, I don't think it's a bold statement to say they have blood on their hands. And I really believe that. I think you don't need to give junkies a lot of reasons to keep using, man. And I know from experience, I kept using because I would say, Suboxone, that's just as bad as the dope. But you put it so eloquently and beautifully. And I thank you for that, Raz. Nothing new there. And I didn't know when I saw you on here, I wanted to say something immediately, but like, I didn't know if you were going to speak, but I love you so much. You're valuable. You're invaluable here. And thank you for taking the time to be here, especially so early after your surgery. We're all thinking about you, and we all love you.
I would not have missed this meeting for the world. This is one of the few things I look forward to every month.
We love you, man.
We appreciate
for
you,
real.
Raz.
All right. I'm going to go, but you guys have a good wrap-up meeting.
Take care of yourself.
Thank you for having a wonderful subject. Thank you for having a wonderful speaker. And I'm seeing you guys in a month.
We'll talk to you soon, Raz.
All right. So before we launch, I got 3 more hands up. I want to get to them all, but I got 2 things I want to interject. First is a reminder that, we never have enough time. We could go for 3 hours.
Yeah, true.
But the discussion and the support continues in our Discord. And I know as soon as I mention that, Devin or somebody from the core team will throw up the Discord link. It's a really, really good community. You can find people like Raz there. All the core team members are there. And it's just really a community of people that really continue the support and assistance for everybody that comes to that space. I did have a question for Kevin. It comes from the chat, and I think it's a pretty quick question. I want to get your take, Kevin. The question is, are there doctors who support a cessation program as opposed to staying on subs forever? The idea is mostly based on the success rate, and do you lean one way or the other?
Great
So
question.
when are you ready to be sober? That's the answer to the question. Um, if you push a person off of their medication-assisted therapy too quick and they're not ready, then what's going to happen? They're going to relapse. They're going to end up right where they were before. Unless they're armed with the tools to succeed a sober life without the medication on hand too, you're kind of setting them up for failure. So I responded to, I think that was Jackie, or I'm sorry, to Carly, sorry, who asked the
Carly.
question that the choice to discontinue therapy or the choice to wean should really be a joint one when the person's ready, when their life is in a place where they feel like they can live without the medication and what it does for them. I'm happy to see a person every month for the rest of their life. Um, I'm happy to be a support for them if they need it. I'm happy for them to keep using the medication as long as it proves a fruitful part of their ongoing sobriety and enriches their life how they want it to enrich their life. That being said, as I said before, Suboxone's an opiate, and the fallout from that is going to eventually be there. Bone strength, heart health, dental disease, all of those things, they all can play a role. But as long as the person that's using the medication long term knows about it, and as long as we risk manage appropriately as the years go by, I am not an advocate for, pushing a person away from a medication because of this, because of, what the data says about success rates.
And this is where a lot of the stigma comes from, right, Kevin? I mean, it's you're trading one for the other. Now you're on that forever. And it's like, yeah, well, I invited the devil in, man. And my life was shit because every waking moment I'm out in the streets trying to cop dope. This is, if it's the lesser of two evils, then so be it.
Yeah.
Again, my lived experience. But that's like the very root of the stigma. You're just trading one for the other, which is a hard thing to absorb when you're somebody just trying to put together a life. And even just, a meaningful, fulfilled life feels like there was a time it feels so far away. But Suboxone's not like, hey, man, I wish we could flip a magic switch and just turn off addiction. I wish that was the case. That's not reality. But Suboxone it has its drawbacks. Like you said, the other shoe drops are sort of heart health, bone health. That's a new one to me. I didn't even know about that one. I'll have a new phobia about that now.
Oh God, don't give him anything to worry about.
I'm just kidding. All right, let me shut up and we'll keep moving. But that really insightful stuff, man. This has gone really, really terrifically. And all the shares too have been phenomenal.
Thank you to the person in the chat who threw that question up for me to ask.
That was Carly. That was our Carly that's always here.
Yes.
I was hoping Carly was in here. Great, really fantastic question, Carly. And I love you, girl. Okay.
All right. So I got 3 more hands up. I got about 15 minutes left. So manage that time as you will. And the first up is Cecilia.
Cecilia, what's up?
Hey, I'm so grateful for this topic tonight. I'll try and keep it short and sweet and to the point. I said it in the chat, like, Suboxone was a last-ditch effort to save my life because I had done everything else, cold turkey, therapy, whatever not, and I would get 3 months and then I'd relapse. And I had family saying, it's the same as dope. You're just switching one for the other, blah, blah,
Yep.
blah, blah, blah. But I'm grateful for it, because it helped me pull together almost 2 years. And then, unfortunately, I ended up pregnant with my little one. And for some reason, don't know why, the medicine started making me incredibly sick. Like, I was losing 20 pounds when I was pregnant, which was not good. Throwing up constantly. Usually it shouldn't do that. I don't know why it did, but it did. And so I had to basically cut almost cold turkey because of that. And the doctors did ask me after I had the baby if I wanted to go back on, and I just decided not to. But that was a lifeline for me because before I couldn't string together more than a couple of months. And I am grateful for it. And another interesting thing, gabapentin. It's not something they use for it often, but it is starting to kind of pop up a little bit more now. They gave it to me to help with my stimulant withdrawals. Um, and it helped, but it had some weird side effects for me. And so I didn't stay on it long. But, I'm just grateful that there are options. And I have, like I've said before, I've been in meetings where I've been told I'm not sober because I was on MAT, which really
Sure.
sucked. But at the end of the day, it saved me, along with in my MAT program, I did have one of those that you had to be in meetings, you had to do random drug tests, you had to be with a therapist, like you had to jump through the hoops to get on that medication and stay on it. But I am so grateful for it. But anyway, thank you to everyone that came tonight. This has been a very awesome meeting.
Thank you, Cecilia.
Yeah, thank you so much, Cecilia. Talk about jumping through hoops. One of my first experiences with Suboxone with a doctor in Kingston, New York named Dr. Cutler, you'd have to go every day to get your Suboxone.
It's very much like a methadone clinic that
Exactly. And I tried it, and he probably doesn't think very highly of me. He met a much different version than this, Josh. So I didn't give the program. All programs, I think they work if you do them. Wasn't ready to do them, but it just was too much jumping through hoops. I think it was even getting tested maybe 3 times a week. But yeah, this was also, Suboxone was new. This is how long ago this was. This was a new drug. It had kind of just reached the point where maybe professionals were aware of it, but us in the streets were just finding out about it. And my friends got me on a program. But Cecilia, I had those other friends and family members and still do. And again, I had to it's a real teachable lesson for me. I had to land in this place of, I can't live a fulfilling life for myself, constantly trying to appease everyone on the outside. Fulfillment, not to sound too much like an after school special, but it comes from here. And I love my life. So if I do run across somebody that says, bullshit, your version of sobriety doesn't line up with mine, that's fine. If you call me unsober, that's fine. And I mean this truly. It's not just lip service. It doesn't matter to me anymore. It matters to me for strangers that I haven't met that might not try this and end up either, gone from earth or hurting themselves to where their life's forever changed. And I know there's many ways to get sober. I would never look down on somebody for going into the rooms and going into the rehabs. They have my support. I just wish that support sometimes was more of a two-way street, but we're working on it. We're working on the stigmas. That's what this is right now. All right, next, Rob, next question. Is it my man, Josh, Ryan?
We got 2 people left, and I got 10 minutes on the clock. So next up is Ryan.
Ryan Benson. Look at him. He's not even ready for us. What's up, Ryan?
Hey, what's up, brother, man? How you doing?
I'm good, man. It's good to see your face in here. Thank you for taking it. So Kevin Ryan is an old friend of mine that we definitely we were addicts. We didn't grow up using together. Ryan was from Ohio, from New York, but we knew each other just for music, from me touring, and both of our lives kind of paralleled down the drain. And Ryan has dedicated his life to helping other people, and he's got years and years and years sober. And he's one of my best. He's one of the friends that a fandom has completely transcended any type of fandom, and he's a lifelong brother. But take it, Rye. Sorry.
Yeah, man. Kev, dude, grateful for your input. I work in treatment. I am a sober living director coordinator for recovery housing with we work twofold. So we do counseling and group therapy, we do MAT therapy, we do abstinence-based type treatment. And like Josh said that meme, I was super jaded about it because of my own bad experience with Suboxone. Primarily Subutex.
Mm-hmm.
I used it in the wrong connotation, right? I was selling it, I was abusing it, I was shooting it, I was snorting it, whatever. Like Subutex, was the money mill, right? People were taking it and trading it for 30s and everything else. So like I had this very jaded view, and I didn't get titrated off of Suboxone. I was in I was in a nursing home. I had osteomyelitis in my spine from IV drug use. It almost killed me. And it's funny, we talk about pain management. We use Subutex after my surgeries instead of opiates. So, but long story short, I came off of it in a crash landing. It was one of the most difficult experiences of my life. I mean, the detox lasted 2 months. I mean, the
So,
physical detox. I didn't get a titrate. I didn't get a cushy little detox
yeah.
with all the cushion meds. I just came off of it, and it was one of the most hardest things that I've ever had to do. But I think that it really cemented a lot of change in my life, and it sent me on a path, a much different path. Like I'm a 12 stepper. Like AA is 100% my life. I bought into it. I drank well, if I'm using proper terminology, the flavor aid, right? Because it wasn't Kool-Aid, it was flavor aid. But I bought into it, and it's become this way of life for me. Well, we talk about stigma, right? You know, Suboxone has a lot of stigma in the rooms. People are like, you're not sober if you're on Suboxone. And on my side of it, working in treatment, I can't work with you if you're dead. I can't help you if you're dead. If Suboxone's what's helping keep you alive long enough for the miracle to happen, then that's what we're going to do. If it's Vivitrol, if it's Sublocade, whatever it is, if it's abstinence, if that's the route that you want to go, then that's great, man. Like we have changed our whole structure. We are starting to intermingle our abstinence-based clients with our MAT clients. That's how we're trying to break the stigma. And I'll tell you what, these abstinence-based clients that go to 12-step meetings, a lot of MAT clients, they don't particularly are fond of going to 12-step meetings, but they're hearing the message from that side. And our abstinence-based clients are hearing the message and the miracle from the MAT side, and it's starting to break down walls for us. I am myself, I'm a counselor. I lead groups. Like I just did a whole group on grounding techniques and mindfulness walks and this, that, and the other for the last 2 hours before I hopped into this. So like I am very passionate about it, and I appreciate Josh's kind words. Like, and I appreciate that there are other people out there on this journey and on this path of helping others. Because, man, I'll tell you what, like recovery is just the end of the day. It's just not to drink and use, right? But everything else is gray areas. If I got to remember that first step, I'm powerless over drugs and alcohol. And when I'm in active use and that switch is on the on position, I'm no longer in control. That's when the disease takes over. And then at that point, my life becomes completely unmanageable. It'll start small, you know. I might forget to pay an electric bill or something silly, whatever it is. And that sounds crazy as it sounds, but that's how the unmanageability starts to creep up. So I'm like, I'd rather stay in the stop position and on the off position.
Hell yeah.
Move forward. So, anyways, I could go on forever and ever, Josh, and I could probably lead a whole hour and a half, 3 hours ourselves. But
well, we should, Rye. You
we might have to have Ryan on
respect.
as a guest one night.
Oh no, we 100% need to. But what you're saying, Rye, about start small and then builds and builds and builds. Brian has a wealth of wisdom and knowledge. You are you're one of my friends that the program worked for. I have nothing but love for the program. I regret not working it. I was in there. I had good people trying to help me. I just wasn't capable of receiving it. I had my own shit to figure out. And in my journey, I really give a lot of credit to me and my brother Barry's relationship. Him and his wife are both, they're you, right? Programmed to the death, dude, but they don't judge me. And I think what you're seeing at your meetings is happening nationwide, where we're starting to crack the stigma. We don't have to say one is, or we can say one is better than the other. I think our mutual respect is all that it takes. And we're trying to keep people alive, right? Both sides. But Rye, for what it's worth, you are a hero to me, my friend. And I love you so much, man. And your life has become one of service, and you're a hero. You're a bona fide hero to me.
too, brother,
Okay.
for sure.
Yeah, man.
Be happy to come on. And actually, I'm going to plug the podcast I was just on, Mental Defectives.
Go for
Friends
it.
of mine. That was the longest episode, but Mental Defectives on YouTube, on Spotify, everywhere. I had a blast doing it. It was the first time I did a video recorded
That's awesome.
podcast, man, but it was a blast. So I would put it up in the chat, but I'm not technically savvy like that.
Me neither, brother.
Welcome to the club. Well,
Yeah.
thank you so much, Ryan. We appreciate you.
All right,
Love you,
Rob
brother.
and Josh. Love you too, man.
And I just in the chat I put the my email address. So drop me an email. We'll get you set up. And our last hand up tonight is Nicholas.
Yeah, so I wasn't really thinking about putting the camera on for this, but my story already got publicly broadcasted because several doctors, ambulance, and other medical professionals leaked the footage online. What they
Whoa.
thought was a public addiction freakout was actually me taking prescribed mental medications and having an allergic reaction to it.
Oh my God.
But I am incredibly thankful for that everything got posted publicly, because when I was in the mental hospital, the first hour, I had 3 people walk up to me, not for shame, for anything, but ask for help, and then asked for how I got on YouTube so fast. So I found out my story got leaked while I was in the hospital. And I had put myself in there because I was afraid of committing suicide. But I got incredibly lucky beforehand. You know, I don't really like to name artists or anything very often, but because Jelly Roll went public, and I literally grew up 5 minutes from where he was. When that went public, my entire neighborhood had my back. Not a single person shamed me for getting help. And in fact, gangbangers, rapists, pedophiles, everything started coming to me for help. Terrified me at first, but it's all right. When I go out, people ask for help, and it's, what can I do? Because as I help other people, I was finding out ways to get treatment myself because I couldn't afford it. I was a caregiver for veterans for over 16 years because at the same time when I was getting them help, the doctors would secretly give me help behind the scenes of what bones were broken, what addictions I was taking too far, because I was already a child prostitute by the age of 10. So my list of addictions was sky high. The only thing I didn't do was heroin and crack and cocaine. Anything else, if somebody put it in front of me, I would take it just to stop the pain. So because that got leaked publicly, people have been coming around from my area asking for help. And while, yeah, I cry publicly and different things, and I'm getting over that, learning, especially with heart support, giving me extra training, it's getting people help in Antioch and Woodbine a lot faster. So I'm incredibly thankful for not only them, but for these opportunities to learn more. And I wanted to say thank you for you guys for putting that together.
Oh, wow.
Well, wow, Nicholas, thank you for sharing, brother. So can I just, for clarity's sake, so you had an episode out in public or in the back of you had an allergic reaction to a medication?
Yeah, it was Seroquel, and I started having DMT-like hallucinations of basically all the people that had raped, molested, or beaten me since the age of 10. And I thought I was going to go in and basically grab a gun and blow my brains out. So I dialed 911 and waited on the front lawn while I was having a freak out. And neighbors and stuff recorded it, but the ambulance drivers in the back recorded it as well and leaked everything online.
And then that video like took off, and all of a sudden you have...
It wasn't really that it took off, but everybody in my city had seen it.
But it sounds like to me, and correct me if I'm wrong, that you've like really dredged a positive from this, and all these people coming to you for help, and that a thing of beauty was the end result. Am I wrong in saying that, or is that not?
Oh, no, because I'll be honest, until I was 31, at least 3 times a year, I committed or tried to commit suicide. And it was until I was 31 when people started asking me for help that I stopped. So I've now almost 2 years without trying to attempt suicide
Well, that makes me
and
really
getting
happy to hear,
sober.
brother.
Yeah, for sure.
Yeah, dude. I mean, you have really incredibly heavy story. So, dude, just on a human to human level, the pain that you're speaking of, like, it resonates with me. And I just want you to know, like, just again, human to human, I feel you, man. And I
Oh,
don't, your
thank you.
pain matters to me. And I think I speak for everybody in this group. Your pain matters here. Your pain matters with heart support. And I hope you come around more and
Oh,
talk
I
to us
will.
more. Yeah, and let us know more and share with us more. That was powerful, dude. Yeah, I'll probably have a lot more, not even questions, just like things to rap about. But thank you for the courage to come in here and share. Uh, that is incredibly courageous. I get scared before these meetings. Every time I get really nervous, and I kind of have these like thoughts of like that I'm either going to mess it all up, or nobody will come, or I'll look stupid in front of Kevin or whatever person I've invited on, and Rob won't be my friend anymore. And those thoughts like live in my mind too. And then I get on here and hear these shares that I'm moved by, and I'm moved by your share. And I just can't tell you how much I want my hurt to matter to other people, but I want you to know in my heart, your pain matters. And here is a place that you can express yourself. And I'm thankful that you came here and shared that with us. I feel honored, dude. I feel honored that you came here and said that. So thank you, my brother.
Thank you.
Yes, thank you.
Fucking A, man.
Thank you very much, Nicholas. We really appreciate you. We're down to we're a little bit over time tonight. And so I again I hate to be the bad guy every month, but I got to kind of move things and keep things in a schedule.
Yeah,
Uh,
Kevin's going to London. This dude's flying to London to race in a marathon, and was kind enough to come and give us our time. I told Rob, I said, tell Kevin to just do it another month, but he insisted on coming on. So he's been really so gracious with his time. Thank you so much, Kevin. Good luck in your marathon. You're like a real deal runner. I have no doubt you're going to crush it. And I will once again shut up and not interrupt my friend Rob.
no, you're good, man. I will echo that. Thank you very much, Kevin, for coming on and sharing with us. And I did not grow up or was surrounded in a background with, that was kind of marked by people openly dealing with addiction. And I learned so much from all these meetings, and I've learned a lot from you tonight, and from everybody that shared, hearing all the different perspectives. I truly want to thank you. I want to thank all of our core team members that are kind of behind the scenes helping me out with the chats. And I want to thank everybody that showed up for this meeting. Um, the We will, following the meeting, I'm going to upload the video onto our YouTube channel. So if you wanted to go back and listen to something, if you wanted to, if you didn't catch something, you wanted to go back and rewatch, you're welcome to do that. And then I will give the last two words to Josh, and first Kevin, then Josh, for any last words before I say goodnight.
Sure. Well, thank you for having me. This is what I do all day long, every day. It's my passion. I love doing it. My best part of my day is talking to people, and trying to help people, in whatever capacity is possible, whether it's sitting there and listening, or giving them some recommendations one way or another. Um, uh, there's no one path for everybody. And I think that's been echoed time and time again. Some people follow the path of strict abstinence. Some people use medication. Some people use faith. Some people use their friends. Whatever combination of all of them that you choose to follow, I hope that it succeeds, and I hope that it leads you to the fruitful life that you really want. It's been a pleasure. Thank you for having me. I'm going to be here every month as long as I can, and I'll always be around if there are questions or anything that I can ever assist with. Okay.
We
Rock
appreciate you
and
so much.
roll.
Josh?
Yeah, just a final quick thing. I want to echo everything that Kevin just said. I also, I said I was envious of people in the program, and that's like a really vulnerable thing to say because it's true. But anyone that's found a way, addict or not, any human being that's found a way to live a life of fulfillment has my undying respect because life can be hard, y'all. Life can chew, y'all. Listen to me. I grew up in New York my entire life, y'all. I hang out with too many people from down south. It's like a natural thing that wears off on you to say, y'all. Life can chew you up and spit you out. Life can be really hard. Anyone that's found a way to find happiness in this life has my undying respect, and that goes for everyone in this meeting and everyone in my life. This has been, as always, a real education for me. I hope everybody that shared will come and share again. And you guys are beautiful. And yeah, once again, just another really moving, powerful meeting. To everybody, to the core team, none of this is possible without this team that we assembled that does so much for DSC. There is no DSC without this team. And I just want to make sure that I echo the same sentiment as Rob, how appreciative, beyond appreciative. I don't have the vocabulary to properly articulate how thankful I am. I don't know. I barely know how to get on Zoom. Do you think I can set this up for everybody to talk on here? I can't. And I'm so thankful that there's so many people that have kindness in their heart and want to put a good foot forward. And that's what we're all doing here. And I find, well, there's community in that. And that's really beautiful. So thanks to the core team. Thank you to everyone that came and shared. I'm going to shut up and go have dinner with my wife, who, by the way, won Phys Ed Teacher of the Year for the whole district. Because she works so much, I never see her. Tonight, we're going to have some dinner, but she knows how important this is to me. And that's it, y'all. Thank you, Kevin. Good luck in London, brother. Rob, I love you, man. I love
you,
everybody
Josh.
in here. I will, Rob, did you have anything you wanted to say, or is this it? We're out.
I'm gonna close out. I'm gonna close out by quoting Devin in our chat because I think he said it really succinctly. He says, "Thank you to everyone who shared their stories as well as supportive, encouraging statements tonight, both in the chat and during the meeting." I will tell you that, and again, I'll plug one more time. That community of people and that type of support is found in our Discord. And I also want to show my appreciation to some people from Heart Support that are in the group tonight. We've got some things we're working on. I think tomorrow, right? 3:30.
Yeah, I'm headed to. I always screw up Onteora and Oneonta, but they're both about an hour and 15 minutes away, so it doesn't matter. But yeah, I'm really looking forward to going, and we're doing some interview stuff, and we'll see what else happens. I'm not really sure what to expect, but I'm looking forward to going. And I just feel really honored that Heart Support fucks with us in any capacity because they are a really well-rounded, solid foundation. They've been around for 12 years of, similarly minded folks who we can learn a lot from. So it always touches me that they come around. Yeah.
As I've told Nate, that Heart Support is aspirational and inspirational.
So. Completely. Yeah. Well, as usual, well said, Rob.
All right, guys. I love you all. Thank you for everything. Kevin, thank you again so much. Josh, thank you. I love you, and I'll talk to you soon.
Rock and roll, you guys. Later, y'all.